Oh, hey y'all. Sorry for getting started a teensy bit late today. I am trying like heck to drag myself into this mid COVID era, as I have recently heard it referred to, by switching to Zoom for some of my video stuff on Facebook. Everybody uses it. It would be easier for folks to interact with me during these if I were on Zoom, I think. And I really just need to expand my skill set and get more comfortable using it. But I cannot seem to figure out how to get it to stream live to Facebook today. And it worked very well the other day when I did the totally unscheduled video, but trying to do it on my pre-scheduled Wellness Wednesday today just did not work. So thank you if you have joined me despite my slightly late start, and I am here today to do the second lecture of the Healthcare Navigation 101 series. So, Wellness Wednesday. I have been doing this series since last December, and this is really my attempt to kind of give back to the community and start to address some of the things that I see going a bit sideways in the health and wellness world. And today's topic is definitely one that is near and dear to my heart. It is all about health literacy. So last week we did a little bit of talking about the who's who of people who are in healthcare and what role primary care is really intended to serve in your total picture of health and wellness. And really, kind of what that boils down to is if you're seeing a medically focused practitioner, like a physician, nurse practitioner for your primary care, you should expect to get a medical based solution to your problems, which most of the time means a pharmaceutical approach, an eventual surgical approach being considered. And not as much emphasis on things like everyday health and wellness tips and training and all the different kinds of education that we need sometimes to be able to deal with pain and to manage our own bodies, really. So, and then did a little bit of talking about the differences between DOs, MDs, and nurse practitioners, physician's assistants, things like that. And then a little bit about the ancillary healthcare providers and how perhaps you may be missing a professional that could help you with something a little bit better than some of those really high level professionals that you end up having to wait 4 and 5 months at a time sometimes to see. So this week, the name of the lecture, of course, is What is Health? And I have sort of mentally named it Health Literacy because that's sort of a big umbrella term for a lot of what I feel is causing complications and problems in the healthcare world these days. So this is a topic that is very near and dear to my heart because I feel like it's something that I understand on a deep level from both the patient side and the provider side at this point. So this is something that I started thinking about initially probably about 4 years ago at this point. I had started to have some fairly significant health problems around the time that I started PT school. And that was in 2016. I was 36 years old at the time. And I was pretty significantly overweight at the time and getting into my late 30s and going into a program with a whole lot of people who were younger than me. And so for a long time, I wrote off some of the issues I was dealing with as being more related to my weight or my age. And I think that that's something that happens a lot in modern healthcare, and it doesn't have to be that way, okay? And this is sort of where health literacy starts to come in. I did not necessarily know what kind of help I needed. I spent a lot of time trying various exercise routines and diet programs to try to get my weight down because a lot of times when I went to see my physician and have my labs done and things like that, my weight was something that came up over and over and over again. And even though I was only 36 at the time, which is really not old at all, I was personally blaming a lot of it on my age and the combination of weight. But even though at a certain point I did start to dedicate some really significant effort towards weight loss, it was actually just making me feel quite a bit worse. And I ended up going from having daily pain in my feet and ankles to having daily pain and swelling in my feet and ankles. And really having pain while I was walking, whereas before it was only towards the end of the day when I was really tired that I would feel pain. And that was something that I just kind of tried to learn to deal with for quite a long time because I had already tried to address it with several different healthcare providers, everything from folks in mental health to 2 or 3 different physicians and even a physical therapist at one point, and nothing really seemed to help. So I ended up doing a lot of work kind of on my own before I finally got a diagnosis, which was after the first year of PT school. And it turned out that my diagnosis was a long-term B12 deficiency that was complicated by a deficiency in D3. So those are both really common vitamin deficiencies here in the United States and abroad as well. And they frequently go undiagnosed. And oftentimes when there is sort of a initially very subtle health problem like that and it goes a long time without being diagnosed, the symptoms just start to pile up and you get into a situation where kind of the most alarming of your symptoms is the one that's kind of primarily on your mind and the one that you're trying to address directly when you get into those healthcare environments and you finally kind of got the attention of a physician or a physical therapist or something like that. But I found myself getting really vague answers most of the time for quite a long time until I was diagnosed. And then when I was diagnosed, my doctor was very excited to have had her theory proven right by my labs. And she explained to me that I had this B12 deficiency and did I want to get a shot today to try to address that. And I am not so proud to admit that my initial reaction when she said that was, no, why? And I didn't trust her. I felt very sort of distrustful of this system that had been telling me for quite a long time. I felt that my problems were really my own fault. And now I'm suddenly being offered what seems like a really simple solution that perhaps should have been discovered a long time ago, or at least that's how it looked from my perspective. And it ended up taking probably around 8 months before the majority of the symptoms that I had associated with B12 deficiency finally went away. And a lot of the reason that they went away over time was because I had to make a really persistent effort, kind of on my own. I was mostly kind of rehabbing myself. I would, I was going through PT school, and when you are going through any kind of health or wellness professional program, a lot of times hypochondria, like thinking that you have every possible illness, is kind of a common condition among students in the health professions. And so I kind of thought that that was what was going on, and I kept trying to talk to my physician about it on follow-up visits and just kind of not getting anywhere, feeling very frustrated. And then as my education progressed, I started to realize that there was kind of this enormous gap between healthcare providers and patients, and that it was really causing a lot of misunderstandings and a lot of difficulty getting good health care for folks. And that issue is one of what is commonly termed in the medical world as a health literacy issue. So health literacy obviously is most frequently associated with an inability to read, okay? So if someone is illiterate, they can't read written word. I learned not so long ago, probably about a year and a half ago, about a similar condition that I had never heard of called innumeracy. So if you are the sort of person who has a lot of difficulty kind of comprehending numbers and doing math in your head and things like that, there actually is a name for that condition, and it is called innumeracy, okay? And that just means that you have an unusually high level of struggles with numbers, all right? The reason I bring it up is because the phrase health literacy is something that I think that people have a tendency to bristle at, and language is one of those things that I think causes a lot of sometimes very contentious misunderstandings between healthcare providers and patients. So if somebody tells you that you have potentially low health literacy, that could be something that is easy to be insulted by, okay? It makes it sound like the person is saying that you're stupid. Or at least that's how I felt when these sorts of things were coming up in my own medical care. And I just wanted to say, really, that this health literacy issue, this gap in knowledge between providers and patients, is something that is vast and it's kind of system wide. And there are actually new research studies that have begun coming out now where they are doing surveys of folks who have chronic pain conditions and the way that they talk about their pain and their healthcare on Twitter versus the medical Twitter community, and how they talk about pain and conditions and how they're interacting with patients, and sort of the vast difference that there is between the two points of view. Okay, patients and providers generally have really dramatically differing perspectives on what contributes to health and wellness. Okay, and to me, in my experience, both as a patient and as a provider, it's really that health literacy component that is usually what is off. So, what is health literacy? Okay, at the end of the day, health literacy can encompass a lot of different things, but ultimately, what you are talking about with health literacy is a usable understanding of how to keep yourself healthy. Okay? It means understanding that it's sort of a multi-step process to remain healthy and well, and it's something that you have to be an active participant in. Okay? And health literacy is something that has a tendency to be really high among folks who come from a, um, a higher socioeconomic status, okay, which basically means households that have greater access to financial resources, aka more money, have a tendency to have a higher level of health literacy than folks from disadvantaged socioeconomic circumstances. And that's one of those things that gets misunderstood on both the patient and provider side all the time, okay? When you are learning about these topics in professional school, you are usually kind of being hit with a fire hose of information, and it's being presented oftentimes as a whole bunch of individual discrete facts, okay? And one of those things that comes up repeatedly with a whole lot of different conditions is the fact that folks from a disadvantaged socioeconomic circumstance are actually much more likely to have a variety of different conditions like diabetes or obesity, or any of these other sort of chronic conditions. Chronic pain is a big one that folks from disadvantaged socioeconomic circumstances and complex family environments have a tendency to get much more frequently. And the problem with being presented all of that information sort of in these individual facts is that it makes it much more difficult to put that information together as a healthcare practitioner in a way that treats the whole person, the whole patient, and takes into consideration why things like that might be, okay? So it's actually very well understood in the healthcare world how things like daily stress associated with not having enough money can contribute to poor outcomes in health. It's very well understood, okay? A lot of times when folks have a panic attack for the first time, they will end up in an emergency room because they are experiencing a lot of very real symptoms, including things like chest pain and hyperventilation and a pounding heart rate, and their blood pressure may be up, they may be sweating. There are all sorts of things that can come along with a panic attack that are very real symptoms. But oftentimes, as soon as somebody hears the phrase panic attack, what they're really hearing is, this is all in your head. And in a manner of speaking, that's true, but the fact is that literally everything that happens to your body is all in your head. Okay, the way that the human nervous system works is there are little receptors all over your body to detect things like pain sensation, pressure, whatever. And all of those little sensors are sending that information back to your central processing unit, which is up here in your skull, okay? And so anything that you are perceiving in the world, whether it's something that you are seeing, hearing, feeling, those are all things that are actually something that your brain is just producing. It's kind of putting it all together for you in your mind. So everything that happens to you is in your mind. And what that means from a medical standpoint is that a panic attack that is causing all of these symptoms, like high blood pressure, sweating, racing heart, chest pains, those are real symptoms just as much as they would be real symptoms if you were having a heart attack, which is oftentimes what it feels like. Okay. So, I say all that to say that things like panic attack, stress, those sorts of things have a tendency to occur more frequently in folks from disadvantaged socioeconomic circumstances for understandable reasons. They contribute to your health in a very real way. And healthcare providers very much understand that for the most part, but we don't always do a very good job of communicating it at all, okay? The fact is that if you have additional stress on your cardiovascular system, which is your heart and all of your veins and arteries and how they move blood through your system, if there is extra stress on that system because you smoke, there may be complex factors that play out differently than if you are having extra strain on that system because you're stressed out, like just strictly mentally stressed out. But the effect of the increase in blood pressure from being stressed out versus smoking are very much the same, okay? And they still accumulate over time. So if you are stressed out every single day because you have a job that you don't like, or because you're broke and you can't keep the bills paid, or because your kids are like trying to do homeschool and it's COVID times, that has a cumulative impact on your health, just like things that we all know are bad for you, like smoking or being morbidly obese, okay? But the fact is that there are certain conditions that, frankly, it is much more profitable to emphasize when you are encouraging folks to take a greater interest in their health, okay? For example, the diet industry, I believe, is I think it's a $60 billion industry in the United States alone. It might be 60 million, but I'm pretty sure it's $60 billion diet industry in the United States alone. And so convincing folks that the reason that they are having health problems is because they are overweight is very lucrative for some people, okay? Convincing people that all of their problems are related to their depression or their stress can be very lucrative for other people because they are selling other products. Sometimes they're pharmaceuticals, and a lot of times I think folks think that there's much more direct influence of money in medicine than, in my experience, really exists. I don't really think that doctors are pushing pharmaceuticals on people because they are getting kickbacks from drug companies, for example. That's something that has come up in my office before as a theory from a patient, and maybe that does happen sometimes, but I have to tell you, the vast majority of folks in the healthcare professions have nothing but good intentions for their patients and really just want to do the best for them. So it's not so much profit motives from your healthcare provider's standpoint, but when it comes to things like health insurance or especially consumer products, that profit motive sometimes makes a really big difference. There are surprisingly lax regulations on what you can and cannot say about products that are applied to the human body, okay? Like things like makeup and hair dye and lotions and the shampoo that you use and the detergent that you use all can have a subtle cumulative effect on your health and wellness. And so what it all eventually sort of adds up to is that we have a system because we are, I mean, I don't want to sound like some kind of like radical political person here, but we are a capitalism based society, okay? So because sort of the profit motive and the right to compete is inherent in so many aspects of our society and especially in our economy, it just means that those profit motives can have a really powerful cumulative effect on folks' wellness just by all of these tiny influences that add up over time. Like, you know, a mistaken belief that something or the other is good for you or at least neutral when it is in fact bad for you. And there's no obligation, of course, to put a disclaimer on most food products or beverages like energy drinks, for example. I think that there actually are some government warnings on energy drinks now, but there is not an obligation to say like this could cause effects down the road, especially things that accumulate over a period of many years, which is how almost everything works as far as the human body is concerned. We are all a very complex set of processes, cells, chemical reactions taking place, millions of things at a time inside our bodies. And so with all of those things happening, it doesn't take long before, overusing certain products that you just like. Maybe it's a bad habit. Those bad habits have a tendency to sort of add up. And that is something that most healthcare providers understand really well by the time they get to a doctorate level healthcare program of some kind, okay? It is sadly commonplace in healthcare environments to sort of hear interactions where, a patient is coming in for the third or fourth time to address a pain issue. Like, just an example, okay? Say a person has recurring headaches. This is something that I've seen time and time again in clinical environments. People who have headaches, especially chronic headaches, especially recurring chronic headaches, they have a tendency to develop a lot of different theories about what causes those headaches. And the fact is, they are really right about a lot of those things. There is nobody who's going to understand what is going on in your body better than you do. And just because you get kind of a blank stare from your physician or physical therapist or whomever you're talking to about it, when you say that you think that X specific food product is triggering your migraines, or that you think that it's related to temperature or something like that, that doesn't mean that you're wrong. It doesn't mean that it isn't a factor. It just means that that healthcare professional doesn't necessarily have any way of knowing for sure. And so I say all of those things to say that if you are trying to make an improvement in your wellness over time and you suspect that there are specific things in your routine that are contributing to a lack of wellness, don't doubt yourself, okay? Don't go necessarily seeking validation from a healthcare provider about it either. Some things can be validated. Sometimes you can talk to your healthcare provider about it and tell them these are my symptoms and I think maybe this is what it means, and they will, have an idea for a test, but that doesn't always happen. And before I finished PT school and started to develop more of a holistic understanding of how wellness worked, I took those sorts of interactions as extremely discouraging as a patient. I really assumed that if there was something to be said about my theory that the way that I wore my backpack was contributing to the pain that I had, that I would at least get some sort of acknowledgement that it was a valid thing to be concerned about. And that doesn't always happen. There is so much liability wrapped up in being a healthcare provider that oftentimes folks fall into the habit of being really reluctant to make declarative statements, which means, like a fact-based, like confident statement about things that are not directly in their wheelhouse. So that's why I did a lot of talking last week about specialization and how it impacts things from the provider standpoint. When you become really specialized in a specific symptom or in a specific symptom or system, sorry, I don't know what was wrong with that today, in a specific system, like the vascular system, the respiratory system, the muscular system, like I am, you start to sort of develop blinders for some of those other systems just because there's one that you know the best. Just like that whole, when you've got a hammer, everything looks like a nail, okay? So if you're not getting the kind of health care that you're really looking for, if you're feeling like these interactions are not necessarily going so well between yourself and your primary care provider or whomever it is that you're talking to about these issues, don't be afraid to sort of branch out and see if you can find a different kind of provider that can help you understand things a little bit better. And so if you're really trying to focus on your wellness, what can you directly do about it? Okay. As far as like improving your own knowledge of how your body works, I think that the number one thing that a lot of folks struggle with is just finding the right help. Okay. if you need help understanding what is in your medical records, for example, if you get test results back from your doctor and you don't totally understand why you've been given a new prescription or why your doctor has given you a specific piece of advice, first of all, take the time to ask that question if you think of it while you're still there. But also know that it's very common for folks to sort of get nervous in a situation where they're in a doctor's office and not necessarily be able to think of everything. So it can be really beneficial to do things like make a list of the things that you want to talk to your physician about before you go in there. And also keep in mind, if your list is like this long, you may not have time to get to all of those things. So sometimes you need to really prioritize and make sure that the most bothersome symptoms or your very specific goal is the subject of the conversation between you and your healthcare provider. So one of the things that we talk about a lot in physical therapy is readiness for change. And when a person has had pain, particularly for a really long time, or they're looking at making some other sort of lifestyle change in order to improve things, there's sort of a set of processes that we all go through, and that most healthcare providers are trained to kind of watch for, and in order to gauge whether or not people are really willing and able to do the things that they need to do in order to take this more proactive role in their health. And so the trans theoretical model is one that I felt worked pretty well for me. And basically, it is the steps are pre-contemplation, contemplation, preparation, action, and maintenance. And what those individual steps sort of add up to. Pre-contemplation, that just means you're not even thinking about making a change yet. Pre-contemplation, okay? Contemplation is you're kind of starting to think about making a change. So, you're at least looking at yourself in the mirror in the morning and saying, I don't feel so good about my weight right now. Or, I feel like my arms don't look as strong as they used to and I want to do something about it. So you're just kind of idly thinking about it. Preparation is the next step. That's when you actually start to make plans and take at least small actions towards that new goal, okay, towards whatever it is that you've been contemplating. And so if you were wanting to improve your fitness, okay, in order to feel better on a day-to-day basis, like a preparation step might be going and picking up a set of dumbbells, or making an appointment with a personal trainer or a physical therapist or a physician in order to get some more information. Action is it's kind of a pivotal point in the process. That's where you actually start taking concrete steps to make that change in your life. So you're not just ordering weights and talking about like starting to lift weights, you're actually lifting those weights. And then maintenance is when you are actually maintaining that change over time, okay? And a lot of times when you get to the action phase, there can be periods of backsliding before those good habits are really set into place. But that is kind of the general process that everybody goes through in making these positive changes. And I think that they fit really well with the cycle of wellness that I was talking about some in last week's lecture, which is prevention, maintenance, rehabilitation, and medical intervention. Okay, so ideally, you're going to be sticking in the prevention and maintenance territory when you're working on your wellness. Like, you may have some old injury that still comes back and bothers you sometimes, but you have learned what you need to do in order to stop that pain from continuing to get worse and start to work back towards feeling better all the time. So that is something that I work with a lot of folks on. A lot of times I work with people on persistent pain conditions, those really long-term nagging pain conditions that a lot of times folks will just think, okay, this is just my life now. I'm just getting old. My knee is always going to hurt. When you are starting to work on something like that, there's kind of a rehabilitation phase where you are really working out the bugs as far as like all the different things that are contributing to the problem and starting to strengthen or lengthen or whatever it is that needs to happen in order to correct that. and then learning how to best maintain that over time, which a lot of times means like picking up a hobby, finding a way to sort of inject those new good habits into your day-to-day life. And then hopefully, assuming you don't have a big accident or a large health problem, you stay away from that rehabilitation and medical side. Um, and the reason that I wanted to kind of touch back on rehabilitation and medical, and trying to sort of avoid that area, is because what this all comes down to a lot of times from the provider standpoint are some pretty deeply ingrained personal biases. Okay. So if somebody comes in to a clinic and they are coming back for the third or fourth time for a problem that is really something that's related to like their posture or their habits or something like that, it is very easy to fall into a pattern of thinking as a practitioner that that person does not necessarily want to address that problem or is not willing to do the lifestyle changes that are necessary in order to address that problem. And then that's honestly just not the case. For most people, a lot of times it is just a lack of understanding, as I was alluding to sort of very early on when I was talking about my own struggles with recovering from B12 deficiency. I could not begin to fathom live in the moment with my doctor how a vitamin deficiency could possibly be such an exciting answer to all of my problems. It was clear that my physician was really psyched about it. She was positive that she was right. And honestly, that is kind of a gift of itself as a healthcare provider, just to feel certain that you understand what's wrong. But I didn't believe her. I I had this distrust from past experiences of healthcare providers, and it was hard for me to just take her at her word. And unfortunately, especially at the physician level and the nurse practitioner level, and especially in hospitals, folks are often so sort of overtaxed with like a large number of patients or a mountain of paperwork for every patient that they are working on, that addressing those sorts of things is not only difficult, okay, it can be impossible within certain systems. You may just not have enough time scheduled in order to address those kinds of more intricate problems. And so that is why I like to get on here and talk for half an hour at a time about these wellness topics, to kind of really explain them from a bunch of different angles, to help people understand that overall wellness really is a very complex process. And you have to make it kind of a dedicated effort. You have to pick your battles. You've got to have clear goals, just like almost anything in life. As much as we might like to have that quick fix, as much as it is easy to understand that a pill or a surgery might make you feel better, that's not always the best solution. And it's not necessarily anybody's job to tell you that, okay? It's not necessarily anybody's job to tell you you may have better luck if you go to a physical therapist instead of a physician, or vice versa, okay? I mean, there is a lot of leeway when you get to, especially the doctorate level of any profession. People, they trust you, okay, to use your own best professional judgment. And unfortunately, when you are stressed out as a provider, when you are in an overtaxed system, when you are having folks come to you for problems that are not even really in your wheelhouse, a lot of times it is easier, it's more expedient, somebody's just having a bad day, to kind of brush those problems off, all right, and not necessarily address them as fully as one would like. So, that is most of what I wanted to say about what is health. Ultimately, health comes down to uh, all of your good habits, all of the things, and bad habits, really. Everything that happens to your body, especially things that happen to your body day after day or on any kind of regular basis, have a cumulative effect. It's just like compound interest in the bank adding up to a big pile of money someday. Those little problems, they add up to a big deficit in wellness sometimes. And the longer those deficits in wellness go on, the more complicated it can be for people like me to figure out what exactly is going on. So, um, to feel better, to be well, sometimes getting to the root of an existing problem can be a gigantic obstacle. If you're lucky enough to be in a place where you feel relatively well, where you're still mobile, consider yourself blessed and do everything that you can to maintain it and keep an eye out for little things that change over time. Okay, one of the things that comes up over and over again in women, actually right around my age, and also in men, but it's just most common in women in their 40s and above, is frozen shoulder. And that is actually a condition that a lot of times starts out as a fairly minor problem that you don't even hardly notice, and then gradually just affects your life more and more and more. So like if you notice something like you can't reach all the way behind your back to hook your bra or tuck your pants in or something like that, that may seem like a really minor problem at first. But if it continues, it can become something that takes a really long time to heal and is really complex, like a frozen shoulder, which can take up to 2 years to resolve, especially on its own. But sometimes, even with therapy, it can take 6 months or a year for that to really kind of get back to a more functional level. So, I think that I've probably rambled enough for today's Wellness Wednesday. If folks have comments on my Facebook page here, please feel free to throw those in the comments now, and I'd be happy to answer your questions. Feel free to send me a message on Messenger via Facebook. And I am sorry that the Zoom thing did not work out today. I will hopefully be able to get that straightened out before we get on Wellness Wednesday again next week. But, I have just learned that I can't make promises about that sort of thing all the time. So I will be hanging around here for a few more minutes, and I will go ahead and hop back on this Zoom meeting so that if anybody wants to sign into that and ask me a question face to face, you can. But other than that, that is the Wellness Wednesday for today. Next week, we are going to be talking in more detail about health insurance, how it's changed over time, and how those changes have changed healthcare over time. And really, the topic in there that is kind of nearest and dearest to my heart is how dealing with insurance regulations and billing can affect somebody's clinical judgment, okay? Because it is real when you are doing nothing but worrying about paperwork or whether something is going to be paid, and especially if you're working for an employer. Those things can really have an enormous cumulative effect, just like little bad habits or big bad habits in wellness. So join me next week, Wednesday, 12:30 p.m. It looks like I can get Facebook Live to work no matter what, so that's probably the most reliable way to tune in live at 12:30, but I also post all of these videos within 24 hours afterwards on my blog on patientphysicaltherapy.com/blog, and I also have a YouTube channel under Patient Physical Therapy. So, yeah, I guess that's all I've got to say today. If you want to schedule a visit, I'm here. Still got same and next day appointments most of the time, so I hope I will be seeing you. Be well.